Good day, everybody. Welcome to Dental Voice with Xyrus. My name is Rolando Mia, and I'm here with Dr. Mike Maroon. He's returning. Dr. Mike was the very first guest that we had on this show. And one of the things that's amazing is during that session, if you have a chance, check it out, he made some recommendations, he made some predictions, and check it out. A bunch of them actually came through. Dental Voice is about hearing from clinicians directly, getting perspectives, opinions, and advice. And this is something that I want to spend with Dr. Mike and see how things go. Good morning, sir. How are you? Thank you for joining us.
Thanks, Rolando. Thanks for having me back.
Holy cow. You believe it's been over 6 months since we first talked?
Yeah, kind of flew by a little, didn't it?
Didn't it? I don't even know what day it is. During that session, it was right at the beginning of the pandemic. There were so many things that nobody knew anything about. All we knew was that we were entering into a pandemic. Places were starting to shut down. Things were happening. Just in general terms, with regard to you and your experience, what has happened, and how have you been able to navigate the last 6 months?
Well, we went from 15 days to flatten the curve to each state kind of making up their own rules and how long they were going to shut down. And some states are still shut down. You know, then the states went into like their phase mode, phase 1, phase 2, phase 3, phase 4. I know in Connecticut, we, initially in the Northeast, we had a tremendous number of COVID infected and a lot of deaths. It's unfortunate, that happened. But then things kind of calmed down. Everybody kind of hunkered down a little, and then what was happening in the Northeast kind of calmed down, and then things started getting worse in different areas of the country. So the governors put some travel restrictions on and things like that. And for the most part, I mean, I think people navigated it as well as they could, because it was something totally new for all of us. We really didn't know what was going on. I mean, it was a novel coronavirus, and and the treatments and the way the disease reacted. People were still trying to figure out how was it spread. Why was some people getting it worse than others? What was the route of transmission? What was it doing to the body itself to cause those symptoms to be severe in some people and not so severe in the other? And I think as time went on and they were able to kind of figure out what was going on, I think people's stress level, like we were up here at the beginning, and now it's kind of like, okay, we can manage this. I can manage it. I see a way through this. People talk about a new normal. In dentistry, I don't think we've really changed as much as we thought we were. I mean, yeah, we're wearing a few more, things. We're wearing some gowns. We're in the face shield. We're wearing the mask, whatever. But we were always, spraying things down and disinfecting and everything else. And depending on where you are, some people have clients come into their reception room and are social distancing. Some people are leaving people out in the car and bringing them in on an individual basis. I think it all depends on what your location is and where you're at. But I mean, those things, I think we've all kind of adjusted to, how we're working through the challenges in our office. It's been good. Things have been good. So for the first month or two, it's kind of crazy. We were nervous, but then we had we shut down in March. We were working 2 days a week for emergencies in April. We started working 3 days a week for emergency only in May, and then June we were back at it full bore. And June, July, August, September have cranked in my office. We've been doing great. So it's like nothing ever happened. It's interesting because the people come in and they're nervous about coronavirus, but they know that we have PPE and we're very cautious about disinfecting rooms before and after clients come in. And so I think, even though we've heard some, rumblings from some national or federal agencies about dentistry is not safe, I think when people come in here and they see us, they realize that, yes, we are safe. So, we like to tell people dentistry, going to the dentist is actually safer than being at home. If you bring your friends and relatives at home, they're not wearing masks, they're not doing whatever. If you go to the dental office, we're all wearing masks. We're all doing what we're supposed to do. We disinfect everything after you move. So the dentist office is the safest place you can be. And I think really you've seen throughout this virus, Rolando, there has never been a cluster of coronavirus that has shown up anywhere in the world from a dental office. So I think that's just another indication that dental offices are safe, and we're doing what we're supposed to do. You know, we've been doing it all along.
I love it. It was interesting. Our bodies, CDC, WHO, that type of stuff, they've not been as proactive as you'd think in establishing specific and clear guidelines. And early on, that made sense because, as you mentioned, nobody knew what was going on. But as we go on, couple hundred, this whole issue of the aerosols, presenting and then retracting the statement. What you just decided, in the absence of that, I'm going to do something. What was that all about? How did you kind of get there?
Well, I think it's common sense. We've dealt with the flu for how many years? Every year there's a different strain of flu that comes out, and we know that if you if you wash your hands or you're wearing a mask or doing whatever, that you're not necessarily going to get the flu. And so, it's a matter of, make sure nobody sneezes on you, make sure no one coughs on you, make sure nobody spits on you. Remember the old story when you were a kid, I want the news, not the weather, when people were talking to you?
Oh.
There are, you don't want to be so close where you're getting the weather from people. You want to make sure that you're far enough away, and I think if you're doing all of that stuff and you're paying attention to what you're doing, that you're going to be okay. You're not touching your face, you're not, sneezing. A lot of people will go, even though you tell them sneeze like this or cough like this, they'll do that and they won't think about it. They'll forget about it, and then they touch everything else. And, so I think if you think about the aerosolization, I think they scared everybody saying that it could stay in the air for 16 hours and things like that. But if you look at the actual research of the size of the droplets of COVID, there's no way they're going to stay in the air like that unless there's a hurricane, unless they're in a hurricane. They're going to go and then they're going to fall. So, and it's been proven because we're in the dental office and no one's getting sick in the dental office. And obviously, if you're using something like Isolite, it doesn't even have a chance to come out of the patient's mouth. It stays in their mouth and it's getting sucked into the suction unit. So I think we've got a pretty good grasp on dentists in general have a pretty good grasp on keeping people safe, and I'm not too worried about it.
If I understand correctly, because there was no real protocol, you wrote one, and now people are using it. Or what's that all about?
I like to say I'm a great plagiarizer. When all of this happened back in March, one of the things that I had a lot of was time, me and everybody else. And, obviously we were online, we're looking for as much information as we could get about it. And I was noticing that a lot of different people were saying a lot of different things, but nobody really had like a good protocol for how they would work in their office. And obviously we were coming back to start seeing emergency patients. And I wanted my team to feel comfortable when they came in that they weren't going to get it. It was kind of like, am I going to get it just by looking at somebody? Am I going to get it if I'm not wearing a mask? You don't know, and people were panicking. It was just crazy. So I looked at some of the ideas that were out there, some of them from national agencies, some of them from friends of mine who were discussing. Smile Source, which is a group that I'm a member of, we had these fireside chats where we had 20, 30, 40, 50 dentists on every night sharing information. And there was a lot of good information being shared back and forth amongst us. And so I started taking the best ideas, came up with a few of my own, and developed a protocol for my office, which I shared with my colleagues in Smile Source. And then some of them started sharing that with their colleagues. And, I heard rumors that it got to like state and national dental organizations and they kind of incorporated a lot of that into their protocol because nobody really had a protocol. And basically what I had written was pretty detailed. And I think a lot of people liked it. That some people modified it to specific office, but I was pretty proud of myself for putting something out there that I think people could modify to their liking as well. So, unbeknownst to me, I probably helped a lot of people relax a little during the coronavirus pandemic.
Well, definitely, and it's interesting because what was interesting during the course of our last discussion, you mentioned this is not the end of dentistry. You mentioned we are going to be coming back, and it's about relaxing, coming down. And sure enough, as you said, offices are opening again. Offices are starting to treat patients again. One thing, though, and I'd be curious to get your opinion and kind of advice with regard to it, is some offices out there are struggling a little bit because their teams are not as comfortable, and because of that, there's a feeling maybe, or a kind of a rift between that, and they're able to find some office teams, but hygiene or hygienists aren't, especially when you saw all this, oh my goodness, hygiene and dentistry at the top of the thing. What advice would you give people who are struggling with that and still kind of dealing with the hygiene issue, staffing, recruiting good folks, and keeping them comfortable?
Well, obviously, it's a personal choice for everybody what level of risk they're comfortable with. So I can understand the argument from the dental hygienist point of view. One of the first things that I did in my practice was I involved my team, as I said earlier, in discussions. Like all the information I was getting, whether it was from CDC or WHO or local and state agencies, we tried to share that amongst each other, and we had conversations. Okay, what are your concerns? What are you really worried about? If you're really worried about aerosols, how are we going to manage that in our office? What are we going to do? So one of the first things I did was we bought Isolite for every hygiene room in both offices, and that was one of the first things. Okay, great. So now here's what you're going to do. You're going to work on the patients with Isolite, and if you want an assistant in the room to be holding a suction at the same time, an external suction, as we have Isolite, that's something that we're going to do. That's that was one of the things that we were going to do for your safety and for the patients. We're not necessarily worried about, because if we're generating their own aerosols, it doesn't matter. I mean, we're not worried about them, but we are worried about aerosolization throughout the rest of the office. So we got air purification, air filtration throughout the office. So we did that. Isolite was one of the other things. I made sure that they felt comfortable with the PPE that we had. We talked about that, Rolando. And one of the things that I had talked with a lot of colleagues about initially was, it's great that we're sharing some of our PPE with our medical brethren, but at the same time, we need to stockpile some PPE, because when we open again, there's going to be a shortage of everything. I mean, and it's not just us, right? It's not just like me in Connecticut. It's everybody in the world now is wearing gloves, using cavi wipes, or whatever other types of disinfectant wipes, using spray. So you have to kind of think, like, you don't want to be a hoarder, but you also have to think, okay, how many of these things do I go through on an average basis? And then where am I going to get this from? And if I can't get it, how can I if I can't get like wipes, how do I make wipes? Or how do I do something so that my sterilization and disinfection level doesn't decrease or diminish to where I'm putting anybody at risk, whether it's patients or on my team or myself. And so those are the things that I kind of thought through. And, we ordered masks, we ordered gloves, we ordered gowns, we ordered wipes, we ordered Isolites. I tried to have my own little stockpile here, so that, and I'm looking at it, okay, they're telling us that you're going to run out, the supplies aren't going to be back to normal status until 2021. So I want to make sure I have enough supply to get me through the end of the year. And I think like I said, being part of SmileSource, we were having these discussions among like-minded people. And I think a lot of us really, paid attention to that. And it's interesting because the statistics that I have from SmileSource is all of the SmileSource offices are performing over 100% of what they were last year at this time, as far as production, collection, and so forth. And the national average is about in the 70s. So,
right.
I think being part of that community really played a huge role in helping me, as well as a lot of other people, prepare and be prepared. But going back to answer the question, if you're having team, distress, it's all about communication. What needs to happen for you to feel comfortable working on patients? That's what I said to my head dentist. What needs to happen? And they said A, B, C, and D. Okay, and I got A, B, C, and D. Are you comfortable? Great. Let's work on patients. So that's how we made it work. And so are they using Cavitrons? Yeah, they're using it, but not on everybody. But when they're doing scaling or root planing, they're doing it, and they're masked out. They got their face shields on. They're N95s. We got air filtration in the rooms. So they feel comfortable doing what they're doing, and as soon as they're done, they go and change and wash up and do whatever. Like they scrub it in for surgery, and they scrub out, and then they go back in for the next patient. And we're giving them enough time to turn rooms over. We're making sure that if they need help, that help is available, whether it's an assistant or a front office person who's wearing appropriate PPE. Is everybody? I've been very blessed. Like my team has really done a good job of pitching in with one another, and I think that's all been because of communication. And I think that's something that you really need to do. So
that's definitely a model, because we've heard that there are some practices out there that potentially haven't even really changed the protocols that they've had, or they become a little more lax because it's like, hey, no one's getting sick. Yeah. And the fact that you're staying on top of that is huge. The context of communication, you did mention that when we last spoke, and how important it is to make sure you involve the team, how important it is to make sure that you're communicating out. You'd mentioned at that time that production had literally come to a standstill.
Yeah.
It's great. So the context of the Smile Source office and your fireside chats, do you think that's what contributed to the fact that the offices are still doing well? Or is it because of those discussions, they were proactive in getting ahead of the curve? Because a lot of practices are still, some of them haven't even opened yet.
Yeah, so, that's scary too. I think yes and yes. The answer is yes and yes to both of those questions. So I think yes, the fireside chats, helped because we were able to. We basically had a huge mastermind group with some of the most brilliant dentists in the country. So that was great. And then yes, we pre-planned and we stockpiled and we did what we were supposed to do. We all talked about it and the ideas made sense and everybody just kind of followed through on it. One of the things that I think a lot of people are experiencing right now is a slowdown in the hygiene schedule. We talked about that before it became a huge problem. And one of the things that we talked about, not only with Smile Source, but also in my own practice, was, hey, these patients, they didn't go anywhere. They're still there. It's just their appointments got canceled. It's like if you were the Grateful Dead and you were putting on a concert. I probably just aged myself with that name. But if you're the Grateful Dead and the concert got canceled, it gets rescheduled to another date. And all the people are going to come back. They still have their tickets. They'll come back. So you canceled, let's say you canceled the end of March, the whole month of April, the whole month of May, which is basically what we did. And I think last time I talked about, I figured I was going to lose a quarter of my year in 2020, right? So I canceled a quarter of hygiene appointments. Those patients didn't leave the practice. They're still in the practice. It's just a matter of now we have to work harder to get them back into the practice. So what we did was we talked to our team. Okay, we're going to have somebody man the phone lines every day. This is going to be your job. When you come in, from the time you come in the morning till the time you come out, all you're doing is making hygiene recare reappointments for all those people who didn't have appointments in the end of March, April, and May. And that's what we did. We made sure that we did it. We booked them in as quickly as possible. Our hygiene schedule is booked pretty normally through the rest of the year. And so I think, again, if you think through the situations logically and you put into action a plan that will solve the problem, I think that it makes sense,
If you were to sit down based on, I love the structure and then the methodology that you use. Are there, or were there things that you thought were going to be effective, or systems that you thought would be helpful, and you've actually stopped doing it, or they weren't? Did you run into any of those that you could share?
I think some of the some of the initial hysteria, there was a lot of equipment that jumped out where people may have, started panicking seriously about aerosols and may have over purchased equipment. So, in my mind, I'm thinking, for me, like the big elephant trunk vacuums, the external suction units and everything else, I thought some of that was overkill. But again, that's for my practice. For somebody else, it may not be overkill. So again, you have to make those decisions based on what you feel comfortable with and what you think your team is going to be comfortable with. I'm not saying that they're not good, that it's not good technology. I'm just saying it has to make sense for you. So there were some things that I looked at. I'm like, yeah, I think that'll work, or nah, I don't think that's going to work. So we made some of those choices, but I think for the most part, really, quite honestly, Rolando, we're doing pretty much the same thing we've done before for years, just with more clothing on. We got gowns, we got N95 masks, we got face shields. We're just hotter. It was great for me. I love having it freezing in the summertime, having the AC down low. So, now I had the women in my office saying, we need to keep it cooler. It was great. Yeah. So I love that. But for the most part, we felt comfortable. Now, I'll tell you what, one thing that you talked about is going back to normal. One of the things that I really had to police well, though, in my office was the break room, when they had lunch and when they did things alone, because when they got back, they felt like they were with family, right? And they are just all relaxed and they're like, oh, yeah, we'll take our masks off and we'll eat all together. I'm like, what's going on here? Remember our protocol? You can't have more than 3 people in the break room. You have to social distance. They're like, are you really serious about that? I'm like, yes, I'm really serious about that. And I said, it's for your protection. It's not for me. I don't care what you guys do. It's your protection. So please follow through. And, I had to be like the bad cop a couple of days, but I mean, they got the message. And then, also if there's more than 2 people in a room, you need to have a mask on. So, like if you're in a business office, like I'm in my office by myself, I got the door shut. I got it. You can see I got an air filtration unit right over here over my shoulder. So, if I'm in here by myself, I'm not wearing my fancy mask, one of my masks. But if
I figured you'd have like big teeth on it or something.
No, I don't have any of those yet. But what I'm saying is, again, it's common sense. If you got more than 2 people and you're in a close proximity, a closed room, then you wear your mask and your PPE. If not, then you do what you normally do.
That's cool. You also mentioned back then that because the offices were shut down, no production, no revenue was coming into the practice, but you still have debt. You still have to pay things off, and you reached out. Did that work? And how amenable were some of the other financial institutions in supporting it?
Every financial institution that I contacted, for whether it was an auto loan, equipment loan, home mortgage, banking institution, they all were flexible, and they all postponed payments for 3 months for me. So I told people, make the call and do that, and they all postponed the payment. So it was worth it, and I'm back to paying the schedule again. I'm paying on time. But, now I had money come in June. We had, June was one of our best months ever because of all that backup. So, we collected a lot of money. We were able to make a decent profit, and I'm able to pay my bills back again and get back up to speed. So it was worth it. And I hope everybody took advantage of that, and they did some things, whether to ease their financial strain.
I mean, that was phenomenal advice, because you were one of the first people to say that, and then you started hearing it, and exactly. Hopefully people kind of took you for that and said, yeah, that's a great idea. I'm sorry, you were going to say something?
One of the things that I said was, at that time, was help your team understand that as well. Part of being a leader is helping your team navigate through stuff like this. Some people, some members on our teams may not have the same financial understanding that we have as business owners, and I read an interesting quote about a business owner I want to share with everybody. A business owner is the person who has all the hassles, obstacles, and disappointing frustrations that everyone else has, yet continues to persist, does the job without praise, and assumes responsibility for the livelihood of not only themselves and their family, but their employees and their families as well. So I think that's a pretty good quote about being a business owner. But part of being a business owner is understanding the financial aspect of everything. And if you have the ability to share some of that knowledge with people, especially people who are working with you, who are living paycheck to paycheck, that was one of the things that I did. I made sure that they understood, here's what you need to do. And most of my team followed through on that. They did what they were supposed to do. They contacted and they got deferred.
That's so cool. And I love the fact that it worked for people. Now, there are offices that still haven't opened, and there are clinicians who are still struggling. And if they happen to see this, what advice would you give them, given, I mean, your practice is back, it looks like it's thriving, you're connected to a phenomenal community, but the clinicians who are not, or clinicians who were maybe caught off guard with regard to planning, what advice would you give them right now, and to kind of recalibrate and go forward?
Well, obviously, step one would be to follow your state guidelines. Like, if your state says you can open, then you can open. Don't be afraid to open. Don't be afraid to go back to work. I mean, the disease is not as contagious in the dental office as it may be in other businesses. So I want to clarify that, okay? Because you wear your PPE and you have your mask, we have our masks on, we have our shields, we have our gowns. The disease is not as contagious in our office as it may be, say, at a restaurant or some other business where you're going, okay? So don't let that be the concern or the limiting factor. Now, if you did not plan to get PPE or masks or whatever, and there's a shortage there, you have to put a plan in place. You need to contact your dental suppliers that you normally do business with, see what you can get, how much of it you can get, and you may need to look at outside suppliers that you haven't looked at before, and you're probably going to end up paying a little bit of a premium for stuff. And don't what's the old saying? Don't trip over pennies on your way to dollars. You know what I mean? Like, if your business is shut down, you're basically making $0. If I have to pay, let's say I used to pay for disinfecting wipes maybe $10 for a little canister, but now I have to pay $20. Don't let the $20 bill for this amount of time stop you from reopening your business. I mean, yeah, your profitability might be a little bit less, but it's only a short period of time before things go back to normal, before production ramps up. So you're looking at, we got 3 months left of 2021. You may have to suck it up and pay a little bit more for 2021, and if that's the 2020, and if that's the case, so what? I mean, do it, yeah. And then you're coming to usually this is the busy season for dentistry. October, November, December, the benefits expire. Send out your use it or lose it stuff. Bring people in. I would tell you, create a plan. Number one, talk to your team, have a meeting. Number two, find out what it is that you need. And if it's supplies, then talk to your suppliers. If it's something else, then talk to somebody else. If you're doing lab work or let's say you don't have income and you have to pay for things that you don't necessarily have money, well, hopefully you took advantage of the PPP loans, which were out there that a lot of people took advantage of, myself included. That kind of helped us. But there are SBA loans available still. The SBA is still lending, so you can get a low interest loan somewhere between 3 and 3.5% from the SBA to help you at least have some cash flow when you go back in to be able to pay. Like I said, you're going to have to buy supplies. So I think those are things that I would consider, doing. And then having your front office staff start contacting patients. Set a start date. If you're still closed, like right now at the beginning of October, don't just say I'm going to open tomorrow. Say, okay, October 15th is our start date. So here's what we're going to do. We're going to, for the rest of October, we would normally be open 6 days a week or 5 days. Let's open 3 days and see how it goes. Let's get our systems in action. And then November, we open up whatever, where we're supposed to be. Have your protocols in place on how you're going to deal with your patients, how you're going to bring them in and out of the office, and then how you're going to deal with anybody who gets sick in your office. If come down with COVID, what are the protocols? My advice would be follow the CDC guidelines on that. And so I think, again, it's just common sense. Just put it, you need to sit down and think through what the situations are going to be, but don't paralyze yourself to the point where you're not going to open. I mean, sometimes you just have to do it, and see how it goes. I guess that would be advice.
That is incredible. And oh my goodness, thank you so much for that. Because yeah, there are people doing that. If people wanted to reach out to you, because I mean, you're so definitive, there's a confidence there, and they wanted to, could they do that?
Yeah, absolutely. Yeah.
What would be the best way for them to reach you if after seeing this, they're like, you know what?
Yeah, my email is drmikemaroon@gmail.com, drmikemaroon@gmail.com. So they can email me there, and then ask me any questions they want, and then I can, I'm happy to answer them, do whatever I can to help somebody else navigate through the crisis.
Awesome. And if they had questions about Smile Source, because that sounds like a really strong community, they can also
happy to introduce them to Smile Source. Yeah.
Oh, fantastic. From a personal, professional, from a family father, from a leader, business owner, from a teammate, what closing comments would you want to give people as they're listening to this?
So first of all, here's what I want people to understand. Coronavirus is real. Okay. I'm talking, Rolando, I've had a personal experience in my family. I lost my mother and brother to coronavirus. So I'm talking from personal experience. It's a very real situation for a lot of people. We've had over 200,000 people at the time of this recording in the United States pass away. I think close to 1 million or over 1 million worldwide. That's a lot of lives lost. It's a lot of loved ones. It's a lot of family members. Okay. So it is definitely still a very real situation and something that you have to be careful about. As with anything, there's common sense and there's being lackadaisical about things. So if you use good common sense, you don't put yourself in situations where you're going to be exposed to a lot of people at any given point in time, unprotected. I don't necessarily care what other people are doing. As long as I have a mask on or I'm protecting myself, I know that I'm going to be okay. I'm not going to catch anything. So I think you have to realize what you're doing. Okay. As far as dentistry is concerned, I think dentists, we're going to be okay. I mean, we're doing well. I mean, if you look at what's happened in the coronavirus, it's actually been great because people are clenching and grinding and breaking their damn teeth. It's awesome. We got a lot more stuff happening. I'm doing a lot more root canals, a lot of extractions, a lot of implants. I mean, I would tell you to look at different things and try and be able to diversify the types of procedures that you offer in your practice so that you're not referring everything out if that was something that you were doing. Like pick one or two things that you really think that you want to get up to speed on, whether it's implants or root canals or ortho or things like that, and try and add some other type of revenue stream into your practice so that in the future or in the event that something does crop up like this again, you're able to come out of it a little bit faster. I think that would be my advice to everybody. But I'm 2021, I think, is going to be great. I think we're gonna keep cranking. The economy's going to keep rolling. And I think everybody's going to this time next year when we get back, October, November, December of 2021, I think we'll look at coronavirus as like anything else. Like when HIV first came out, they'll we'll have some type of treatment for it, a treatment protocol, and I think the virus itself will mutate to where it's not killing the host. It's going to become a more milder version of itself, and I think we'll be okay.
Thank you so much. Thank you for that, and really appreciate that. Hey, appreciate you taking the time. Those of you who are watching this, if you want to reach out to Dr. Mike Maroon, please send him a message. He's got some incredible advice and a wonderful perspective. If you like the content of this, please share it. If you have questions for us or would like us to cover other things, please let us know. Dr. Mike Maroon, months from now, to your point, back when we get into 2021 and things are going crazy again, would you be open to joining us again and then sharing how things are going?
Yes, absolutely. Yeah.
Awesome.
Yeah.
Thank you so much. Hey, have a great and safe rest of your week. I really appreciate you taking the time and look forward to continuing to talk to you.
Thank you, Rolando.
Take care.